Muscle relaxants are a group of medications commonly used to help relieve pain and discomfort caused by muscle spasms, spasticity, or myofascial pain. Despite their widespread use, many people are unaware of how these drugs work, their different types, and the best ways to use them safely. In this video, we'll explore the basics of muscle relaxants, their indications, and how they fit into the treatment of both acute and chronic pain, especially low back pain. By the end, you'll have a clearer understanding of when and how these medications can be helpful, as well as the risks to watch out for. Muscle relaxants are medications designed to reduce muscle tension and alleviate pain. They are often prescribed for conditions like low back pain, muscle spasms, and certain neurological disorders. However, the term muscle relaxant actually covers a wide range of drugs that work in different ways. Some act on the central nervous system while others target the muscles directly. Understanding these differences is key to using them effectively and safely. Let's look at the main categories and why they matter in clinical practice. There are several types of muscle relaxants, each with unique properties and uses. The main groups include antispasmodics, antispasticity agents, and drugs for myofascial pain. Antispasmodics like cyclobenzaprine and methocarbamol are often used for acute muscle spasms. Antispasticity agents such as baclofen and tizanidine are more commonly prescribed for conditions like multiple sclerosis or spinal cord injuries. Some drugs like diazepam can serve both roles. Knowing which type to use depends on the underlying cause of the muscle problem. Muscle spasms and spasticity are often confused, but they have different causes and symptoms. A spasm is an involuntary contraction of a muscle, usually due to injury or strain, and is often temporary. Spasticity, on the other hand, is a persistent increase in muscle tone caused by central nervous system disorders, such as stroke or cerebral palsy. Recognizing the difference is crucial, as it guides which muscle relaxant is most appropriate for treatment. Myofascial pain is a chronic condition characterized by pain and tenderness in specific muscle areas, often referred to as trigger points. Unlike acute injuries, myofascial pain tends to persist and can affect daily activities. Muscle relaxants may be used as part of a broader treatment plan, but their effectiveness for this condition is still debated. Understanding myofascial pain helps in choosing the right therapy and setting realistic expectations for recovery. Muscle relaxants can act either centrally, affecting the brain and spinal cord, or peripherally, targeting the muscles themselves. Central acting drugs like baclofen and diazepam influence nerve pathways that control muscle activity. Peripherally acting agents such as dantrolene work directly on muscle fibers to reduce contraction. The choice of medication depends on the source of muscle pain and the patient's overall health profile. Some of the most frequently prescribed muscle relaxants include cyclobenzaprine, methocarbamol, carisoprodol, baclofen, tizanidine, and diazepam. Each has its own onset time, duration, and side effect profile. For example, cyclobenzaprine is often used for acute back pain, while baclofen is preferred for spasticity. It's important to tailor the choice of drug to the patient's specific needs and medical history. While muscle relaxants can provide relief, they also come with potential side effects. Common issues include drowsiness, dizziness, dry mouth, and in some cases dependence or withdrawal symptoms. Some drugs like carisoprodol and diazepam have a higher risk of abuse and should be used with caution, especially in people with a history of substance use. Always discuss possible side effects with your healthcare provider before starting a new medication. Older adults are more sensitive to the side effects of muscle relaxants, particularly those with anticholinergic or sedative properties. Medications like cyclobenzaprine are generally not recommended for elderly patients due to increased risk of confusion, falls, and other complications. It's essential to weigh the benefits and risks carefully and consider alternative therapies when possible. Muscle relaxants are most effective when used for short periods, typically less than a month, to manage acute pain episodes. Long-term use is generally discouraged due to the risk of side effects, dependence, and lack of evidence for sustained benefit. For chronic pain, other strategies such as physical therapy, exercise, and interdisciplinary pain management are often more effective in the long run. In many cases, muscle relaxants are used alongside other medications, such as nonsteroidal anti-inflammatory drugs, NSAIDs, to enhance pain relief. Studies suggest that combining these drugs can be more effective for acute low back pain than using either alone. However, it's important to monitor for increased side effects and interactions, especially when multiple sedating medications are involved. There are situations where muscle relaxants should be avoided or used with extreme caution. These include patients with liver or kidney impairment, a history of substance abuse, or those taking other sedating medications. Certain drugs like chlorzoxazone and carisoprodol have specific risks that may outweigh their benefits in many cases. Always consult your healthcare provider to determine if a muscle relaxant is appropriate for you. Muscle relaxants such as baclofen and diazepam can cause withdrawal symptoms if stopped abruptly after long-term use. These symptoms can be serious, including seizures and hallucinations. It's important to gradually taper the dose under medical supervision to minimize risks. If you've been taking a muscle relaxant for an extended period, talk to your doctor about the safest way to discontinue the medication. Chronic low back pain and other persistent conditions, muscle relaxants should not be the sole therapy. Instead, a comprehensive approach that includes physical therapy, exercise, and self-management strategies is recommended. Interdisciplinary pain programs can help patients develop skills to manage pain, improve function, and reduce reliance on medications. This holistic strategy leads to better long-term outcomes. Muscle relaxants can be valuable tools for managing acute muscle pain and spasticity, but they come with important risks and limitations. Short-term use, careful selection based on the underlying condition, and close monitoring for side effects are essential. For chronic pain, focus on non-drug therapies and a team-based approach. Always work with your healthcare provider to find the safest and most effective treatment plan for your needs.